We're now delighted to be joined over the telephone by our guest for the afternoon, Dr. Eslam Annan, Lecturer of Health Policy and Health Economics, St. Shams University. Dr. Eslam, a very good afternoon to you, sir.
Good afternoon.
Thank you very much, Doctor, for joining us. Let me start by asking you, Doctor, about the role, the critical and pivotal role that Egypt is playing with regards to getting aid across the Rafah border crossing into the Gaza Strip to cater for the basic living needs of the people in the Gaza Strip. How do you see the importance of this role and the necessity of the sustainable aid that needs to be delivered on a daily basis in a sustainable manner?
That's a very good question, and we can summarize it just in one sentence. It's life-saving. What we are witnessing is actually catastrophic. Catastrophic in terms of definition, catastrophic in terms that we can see that a lot of casualties currently. We are speaking about more than 10,000 casualties. Predominantly, we are talking about women and children. And we are talking as well, maybe more than 50% of Gaza's buildings have been destroyed, and almost 1.5 million people from the population have been displaced. So it's very pivotal, it's very life-saving that we keep sustainable aid entering the borders, as well as we are receiving all the individuals and injured patients who should receive treatment in Rafah hospital. Both are actually very important. First thing is to enter a lot of sustainable aid inside. We are talking about Gaza Strip, and just to highlight that even before the 7th of October, there's 1/3 of the population of Palestine was actually food insecure. And almost the shops are nearly exhausted. And when we are not talking this month, we are talking even before. So they depend mainly on aid to make their lives sustainable. What Egypt is doing, and President Fattah al-Sisi insisted that should be sustainable, is we continue delivering aid inside Gaza Strip and expanding as well in terms of infrastructure in Rafah Hospital, so we can receive as much patients as possible till they can get their treatment and then send back to Gaza Strip after the situation, inshallah, will calm down.
Indeed. Now, Dr. Eslam, when we're talking about aid, obviously we're talking about medical supplies, whether it's medicine, stuff that they need in order to help with the recovery and treatment of people that have been injured. And we're also talking about food and clean water, which is also becoming now a critical point for the citizens of the Gaza Strip, clean water to drink. How important are these basics in order for the citizens of Gaza to survive and even for the injured there to recover?
That's a very two important points. The point of sanitation and drinkable water is very important to prevent any pandemics or any infections that can elicit in the future. We are talking about cholera, for example, and we've seen cholera emerges a lot in war zones and in conflict zones.
Yes.
And unfortunately, and we wish this won't happen, but it's a very common thing. And once we do have cholera, we do have dehydration. We have a lot of infections among children and infants, as well as we are even seeing a lot of babies injured and a lot of bodies under the buildings. And that as well is very dangerous and arresting and alarming point for the infection coming from the dead bodies where they are not correctly buried. And even we got a lack in terms of bags. We need bags so we can bury the dead bodies. Unfortunately, we're saying these phrases, and my deep condolences for all the families and our families there in Palestine. But the health status there is actually collapsing, and mainly 75% of the hospitals, they lack the basic needs to operate even for ER. So entering the medical aid in terms of the surgical procedures, tools to enable the physicians and the doctors there to operate. Also, we are neglecting a very important point, which is the chronic diseases patients. So we are talking about diabetes, hypertension. Even these patients, they don't have their medication. If the occupation troops are actually bombarding Gaza Strip and Palestine and depriving them from fresh water or even from living, they are as well depriving them from getting their treatment, which is very unhumanitarian, that they cannot reach their blood pressure medications or even for dialysis. We are talking about a lot of patients that they need dialysis units 3 times per week, and they cannot see it. And unfortunately, they will eventually die if they cannot do their dialysis session. And that's why, by the way, in Rafah Hospital, it was equipped by a lot of dialysis equipment so they can run their dialysis. But we need to let them actually go to Rafah Hospital, and we need to let our aid to enter Rafah Hospital. We need at least 100 trucks per day so we can at least provide the essential living tools.
Absolutely. Now, in cooperation with the Blood Bank and the Health and Population Ministry, the National Alliance for Civil Development Work has launched a nationwide campaign for blood donation under the slogan, "A drop of blood equals a life." Could you tell us a bit about the importance of joining this effort of different state institutions, civil society, you know, people from all across the country? How important is this drive to help alleviate and save a life of a Palestinian brethren?
It's actually life-saving, as you said. The Red Crescent and the international organizations, they are trying to push hard that we can have as much possible quantity and amount of blood bags on the border, so we'll be ready to be transferred inside Gaza or at the Rafah hospital. And that's number one tool that all the physicians in ER, they are in real need to it, especially that most of the patients are patients who are actually injured or they need to do a surgical procedure. So without blood bags and without donations, unfortunately the survival percentage and probability will approach 0. So it's very important, and from the program, and thank you for raising this question, we urge everyone to donate blood to the Red Crescent and the international organizations. So we'll be ready once the borders will permit the full capacity of the blood bags and the ambulance to enter Gaza, to be there inside Gaza Strip and at Rafah Hospital.
Right. Dr. Eslam, now we've seen the World Health Organization, WHO, of course, denouncing the lack of safety guarantees for the aid convoys, you know, inside Gaza, stating it was almost nearly impossible to get medical supplies to the hospitals, and they emphasized that the health needs in the Strip are soaring whilst the ability to meet them is declining. What, in your opinion, are the measures needed? What can be done to provide international protection for these defenseless victims, ensuring safe and swift access to medical supplies and medical treatment for them?
First of all, we need to apply the laws and regulations of the safety of the medical aid, for the safety of healthcare professionals, that the Zionist occupation troops are not respecting at all. We need a movement from the international organizations and the international bodies so they can at least respect that the healthcare professionals can enter and the convoys can enter to treat patients. It's not actually war. It's they are bombarding everything. They are bombarding hospitals, even ambulances. So I agree, and I second what the Director General mentioned, that there is no safety or security for the medical aid, and I believe it is intended, so they don't even got any medical aid from outside. So we are talking about a complete genocide. So unfortunately, not my voice will change or move the things, but the first and number one thing to be done is movement from the international organizations and from the international bodies, like the UN and all the international bodies seeking democracy and talking all the time about freedom, that we need to let professionals and convoys to enter Gaza Strip and to help the Palestinian children and women. We're not talking about army, we're talking about women and children to get their treatment and be safe, and at least provide the essential humanistic approach while they are actually bombarding hospitals and bombarding women and children.
Right. Dr. Eslam, also, you know, as you know, the Israeli forces, the occupation forces are targeting hospitals and emergency centers. How far can the Egyptian healthcare services in Egypt provide Palestinians with at least field hospitals at Al Arish and Rafah crossing? How effective are they, in your opinion, to at least, you know, receive the injured, start with life-saving measures before they are transported to hospitals?
So that's actually what His Excellency Dr. Khaled Al-Rafar mentioned, that we are capable enough to provide all the capacity and all the resources needed to treat the patients crossing the borders, but let them cross the borders to take the treatment. the Rafah Hospital and all the governmental hospitals in the Strip and inside Egypt borders have been currently in full capacity in terms of medical procedures. There's a lot of physicians who actually volunteered inside Egypt. We are talking about 8,000 physicians who submitted that they would like to volunteer in hospital, nursing as well. We do have the dialysis unit, the emergency and surgical procedures are already there and equipped. We can see departments, full departments from the Ministry of Health on a daily basis on the borders, making sure that if we do receive any number of patients, we are fully equipped to treat them and make the better and the good triage for all the patients and direct them if they need a specialized service, for example, even if it's inside Cairo, we can send them to Ma'ad Nasser, like what happened with the case last week, and they'll return back to the Gaza Strip. But first of all, please make us do the triage. We are fully equipped. We can actually provide help, but if they can let the Palestinian and the injured enter the Egyptian borders, they get the treatment and turn back. And by the way, just to remind the audience that previously and before the 7th of October, we do have on a monthly basis a lot of patients coming from Gaza to Egypt to receive their treatment and return back. So even those for chronic medication they are not receiving. We're talking about cancer patients, dialysis patients, and we are talking about pregnant women we expecting to deliver. By the way, in Gaza, there is 50,000 women currently pregnant, so we'll be expecting a delivery soon, and there is no a single sanitation tool or a hospital who can actually deliver a safety and a secure delivery for these women.
Indeed, quite a humanitarian, crisis in this regard. And we've seen also the North Sinai hospitals at the highest level of preparedness to receive injured patients and Palestinians. Most of the wounded have been transferred from Gaza, have sustained serious injuries. We're talking about at least 60 of them being women and children. Tell me a bit about the Ministry of Health's, medical precautions, medical preparedness. What have they done in order to prepare for the influx of the women and the children? Has there been a stock up with regards to provision, for example, of vaccinations, which children need in different stages of life in the first few years, etc.? Tell us a bit about some of the preparedness of the hospitals to receive the women and children.
So once the bombarding started, there is a whole health policy positioning that has been made from the Ministry of Health and Population, which starts first by making sure that all the patients entering Egypt are fully protected and they are free of any germs, infections, and so on. And that's the quarantine start point starting from the entry of Egypt. Then there is a vaccination step where they take any necessary vaccination. We're talking for children, for example, they need to take polio vaccine. And for the rest, we need to make sure if injured, they are taking the necessary vaccination so we are not entering any gangrene or any bacterial infection later on. And then the third step is the triage, where the physicians, they start to direct patients towards the right department and the right ward to get their treatment. Most of them, as you mentioned, entered the ER for surgical operations due to wounds and injuries from the bombarding already happening and from the bombs themselves. Some of them, they are currently under investigation to detect whether any chemical substances was actually thrown in them in terms of a bio-war or a forbidden substance that actually the Israeli troops used or not. And then the healing part, what we all depend on and what we all aim, which is the treatment outcome itself. And here comes the very important point of having clear clinical protocols and treatment protocols for all the people entering from Gaza Strip to Egypt, and then write the final report to understand how many cases that we need even to forecast in the future for, as I mentioned, for cardiovascular disease operation, for even medications that we need for their chronic disease, for dialysis, for cancer treatment. And all these were actually accounted for, and currently we do have the list and all the necessary medications, procedures ready to treat as many as possible from the Palestinian patients entering the borders.
Right. I'm afraid we have to leave it there. Dr. Eslam Annan, Lecturer of Health Policy and Health Economics, thank you very, very much, sir, for your time and your insight and for joining us on today's edition of Cairo Local Time. Ladies and gentlemen, a short break and we'll be back to continue. Do stay tuned.